Greetings, Council. I wish to remain anonymous.
Your name and the city you're from.
I wish to remain anonymous. It's not important my name or where I'm from, but the message I'm going to bring. Who am I? I'm a self-taught medical researcher and epigenetics health advocate with over 15,000 hours devoted researching complex medical journals and databases. Again, my name's not important, rather the information and words I offer you are. If masks worked, why the 6 feet? If the 6 feet works, why the masks? If they both work, why the lockdowns? And if all three work, why the rush vaccine? If the vaccine is safe, why the no liability clause? Americans are being harshly judged for disobeying coronavirus mask guidelines, and the social pressures are more dangerous than the risk from the virus. Mask wearing has become more of a talisman of religion than an effective therapeutic. On April 3rd, 2020, the CDC announced everyone should wear face masks, wash their hands, and clean the surfaces in order to prevent the spread of COVID-19. May 2020, researchers proved the exact opposite. May 2020, Dr. Xiao, an epidemiologist from the University of Hong Kong, and her colleagues ran a paper entitled Nonpharmaceutical Measures for Pandemic Influenza and Nonhealthcare Settings, Personal Protective and Environmental Measures at Emerging Infectious Diseases, in which they sought to separate myth from reality and to demonstrate what data-driven measures can be helpful in preventing the spread of COVID-19. Xiao's research showed the opposite of the April 3rd, 2020 statement from the CDC to be true. The summary of their findings: it doesn't matter if you sanitize surfaces, it doesn't matter if you wash your hands, and it doesn't matter if you wear a mask. The CDC Journal, 5/1/2020, masks don't work. There's no proof that they work with COVID or influenza. Quote, we did not find evidence that surgical type face masks are effective in reducing laboratory confirmed influenza transmission, either when worn by infected persons, source control, or by persons in general community to reduce their susceptibility. Sadly, the use of masks is entirely driven and justified by alleged new cases. In a stunning development, former chief scientific officer for the pharmaceutical giant Pfizer says there is no science to suggest a second wave should happen. The Big Pharma Insider asserts that false positive results from inherently unreliable COVID-19 tests are being used to manufacture a second wave based on new cases. Dr. Mike Yeadon, a former vice president of the chief scientific officer for Pfizer for 16 years, says that half or even almost all of the tests for COVID-19 are false positive. Dr. Yeadon also argues that the threshold for herd immunity may be much lower than previously thought and may have been reached in many countries already, such as Sweden. Yes, some will get the virus and not have good outcomes, just like the flu. And some will push narratives to destroy the economy and has caused many more deaths. We pray for those who have lost their businesses and took their own lives. As of September 10th, directly from the CDC website, here are the facts. The U.S. government last week updated the survival rates, if infected, for COVID-19.
1 minute.
If you're from the ages of 0 to 19, you have a 99.997% survivability rate, 20 to 49, 99.98%, 50 to 69, 99.5%, 70 plus, 94.6%. Studies have shown that those with pre-existing conditions are at the highest risk, such as diabetes or cardiovascular disease. Governor Ron DeSantis lifted all restrictions on restaurants and other businesses in Florida on Friday and banned local fines against people who refuse to wear masks as he seeks to reopen the state's economy.
20 seconds.
If the governor announcement Friday allows restaurants across the state immediately reopen at full capacity and prevent cities and counties from ordering restaurants to close or operate at less than half capacity. Masks inhibit the flow of oxygen to our brain, to our lungs, to our body. Oxygen is essential for life.
Thank you.
I do not consent to the use of masks.
Thank you.
Cassie Dunn from Prospect Avenue, Lewiston. Not going to give you my immediate address, but like my husband said, our exact address is not pertinent. What is pertinent is the information that we're sharing. So for me personally, this hits home so hard. I have a friend who had a family member pass away within the last month because of oxygen deprivation. She was forced to wear a mask at her job, even though she had a health issue, forced to wear it 2 weeks. She wore it 2 weeks, 6 hours a day, and she died. And the coroner's report said verbatim, carbon dioxide poisoning. You guys have no business telling anybody ever to put anything on top of their face that inhibits their ability to absorb oxygen. Where oxygen thrives, disease dies. Now, health is extreme radical responsibility. Just like it's not your business to tell people whether or not they take vitamins, eat healthy food, exercise, smoke, or drink, you have no business telling them to do anything to put something on their face. You guys want to pretend like you're actually afraid about what's going on? Guess what? You think you're helping people? Your body is expelling things. You're supposed to expel the pollution. You're supposed to expel the viruses. You're supposed to get rid of the bacteria. You're supposed to breathe it out of your mouth, not absorb it back in. So you think you're helping people by putting this thing on your face? And then you breathe all those germs on there, and then you turn around, you breathe it right back in, you increase your odds of becoming more sick. It is absolutely disgusting how illegal you guys are doing and how much you go against the Constitution. I do not consent to the mask. I will never consent to the mask, and shame on you because you are literally helping kill people.
Thank
It's disgusting.